Hello and welcome to HealthAfrik on AAU TV. AAU TV is the voice of higher education in Africa, and HealthAfrik is your favorite health show on television today. For this season, we bring you a 5-week series on contraceptives. Men use contraceptives, women use contraceptives. At a certain point in your life, as a man and a woman or a couple, you have to use a contraceptive because you can't keep giving birth, okay? And you're thinking, is this safe? Is it effective? Is it available? And there are lots of contraceptive methods. There's the pills, there's the IUD, there's the injectables. There are a whole lot. Today I'm here at Staywell Health Clinic with Dr. Ababio to help us delve more into the issues of contraceptives to decide which one works for you. My name is Bridget Ama Denteh. If you really want to know more, please stay tuned. I'll be back shortly after this break. Welcome back from the break. My name is still Bridget Ama Denteh, and I have here with me Dr. Ababio to help us delve more into the issues of contraception. We are trying to know which contraceptive method works best for you. Dr. Ababio, you're welcome.
Thank you.
It's a pleasure to have you here today.
Yeah, same here.
Yeah, and it's a pleasure to be here at Staywell Healthcare. You have such a beautiful place.
Thank you.
And it's so simple, you know, everything is just on point. Okay, so to start off, I'd like to know, what is a contraception, or what is a contraceptive?
Okay, so simply put, contraception is using techniques or products to prevent pregnancy as a side effect or consequence of sexual intercourse.
Okay.
Most people would like to think the only reason why people have sex is to have babies, but sex is also for enjoyment and for other stuff. So yes, it's babies are good, pregnancy is good, but it's not always the desired side effect of sex people are looking for.
Okay.
So contraception is just trying to prevent pregnancy as a consequence of sexual intercourse.
Okay.
It is mostly used interchangeably with family planning a lot. And yes, they are actually very similar, but family planning is a bigger umbrella that uses contraception to actually achieve its goal.
Okay.
So family planning gives you the available methods that enables individuals and couples to sort of decide and attain the number of children they want, the timing of their birth, and the spacing of their birth. And in so doing, they use contraceptive methods.
Okay, okay. So what would be some of the benefits aside the fact that you don't want to get pregnant, so you use a contraceptive?
Okay, so there are numerous. Contraception is actually very, very important in actually the society at large, let's put it that way. And the benefits are way more than just preventing pregnancy. The benefits are to the individual, to the family unit, including the children, to the society as well. So let's start with the individual.
Okay.
It allows people to plan their families, whether they are married or not. I can be able to decide when I want to start having children, how many children I even want in the first place. It allows people to do that. It also enables families to actually enjoy their, let me put it, to enjoy intimacy without the fear of pregnancy. Sex is very important in marriage and relationship, let me put it that way, for people who are married as well.
Yeah.
And I don't think everyone wants to be worried about children every time they have sex. So it sort of puts a strain on the relationship if it's all you think about. Every time you want to have sex, you're like, oh, I may have a kid. How much is school fees? So it's quite disturbing when it comes to things like that. So it frees people to actually enjoy each other without the fear of pregnancy. So it's saving your relationship as well. And then apart from that, it empowers both the female and the male. People would like to think pregnancy affects just the female, but if you have a supportive partner, it affects both. But you know, when we talk about contraception, we focus on women because at the end of the day,
Yeah.
the man always has the option to walk away,
Yeah.
but you're stuck with the baby.
Yeah.
So it becomes the responsibility sort of the woman. But if it's done right, it allows both of them to be able to achieve career progressions.
Exactly.
And then it enables them to work better hours without having to worry about kids they didn't plan. Therefore, it means they are earning better money. They'll be able to take care of the few they have or even the ones they plan to have. So essentially, it makes the family unit, it makes them able to have a better quality of life. Let me put it that way.
Okay.
And then apart from that, let's come more socially or even more medically. Pregnancy is associated with so much risk. I don't know if you know, but it's not an easy 9 months. It's not a quick in and out like we assume. Pregnancy can be a bit stressful on the individual. So imagine getting pregnant by mistake and then you have all the risk factors. So it's what we preach is pregnancy by choice and not by chance.
Yeah.
Because pregnancy will expose you to DVT, hypertension, diabetes. It's a whole lot.
Wow.
So if you are not pregnant in the first place, then you're not likely to have these risk factors associated with pregnancies as well. So yeah, that's also another reason why we preach contraception. And then talking about unsafe abortions, pregnancy really saves us from that. Whether we like it or not, kids and even grown-ups are having sex. Married people are having sex. They're getting pregnant with babies they don't want, and then they are sort of shamed into thinking because they are married or because they are children, they are not supposed to be having sex or be having this many children. So they tend to need an abortion. Yes, and then in so doing, if they don't seek treatment from the right place, they end up having unsafe abortions. Comes with a whole list of risks we can't get into right now. But yeah, it saves, contraception actually saves us from
all of
unsafe, the need to even have an abortion in the first place because there's no pregnancy. So we don't even need to have an abortion. How much more talk about a safe abortion. And if we're talking about abortions, then let's talk about teenage pregnancy as well. Contraception is protecting our kids from teenage pregnancy. We would like to preach abstinence, but not all the kids will listen to you. So it's good to always have an option. It's good to abstain. It's good to preach abstinence, but it's always healthy to have contraception as an option in case they are not able to abstain. Then you know that they have something protecting them. That means that they have the chance to further their education, to live their dreams without feeling like they were stuck with a baby that they didn't plan for. So it's also an important reason why contraception is important. And then let's talk about the society as a whole. If we are being honest, overpopulation is a problem. It's a problem. Not only are we having kids we cannot cater for, the very few social institutions that have been put in place, they are not able to take care of all of the needs that we have, especially with the schools and the hospitals. So it sort of helps us to control population at very healthy levels, and then everyone is happy. The family is happy, the government is happy.
A win-win situation.
It's a win-win situation. Apart from that, contraception, some method of contraception actually protects you from STIs. When we talk about contraceptives, people are thinking baby, but some of them, especially the barrier methods, the condoms, they also protect against sexually transmitted diseases such as HIV, which is quite important. And then we have contraceptive products being used to cater for people with menstrual disorders. And then contraception actually also protects you. It reduces your risk of getting some cancers.
Really? I thought it rather increases your risk.
So for that's the thing. There are cancers that it increases your risk for, and there are cancers that it reduces your risk for. So at the end of the day, you want to weigh your options. you want to weigh options and decide which one I want to go in for. Because it reduces, by the virtue of the fact that you have a uterus, you have ovaries, you're at risk of endometrial cancers, ovarian cancers and all that, but contraception actually reduces your risk of all those things.
Okay.
So,
is there particular contraception that reduces that risk?
Yes, so the hormonal contraception,
okay,
especially the progesterone contraceptives, they do that a lot.
Okay, you've already mentioned the pill and then the condom. What other methods of contraception are there?
Okay, so it's a long list. I'll try to group them so that it makes sense. So we have the barrier method.
Okay.
The barrier method is just putting a physical barrier between the sperm and the eggs so that they don't even meet to cause baby problems. Yes. And then we have the hormones. The hormones sort of regulate what you have already. So we have the estrogen and the progesterone. So the hormones, what the hormones do is that they regulate themselves in order to keep you safe, to keep you in your safe period, so that even if you're supposed to have sex, a baby will not be a result. Okay. And then we have the traditional method, which Ghanaians love a lot because they don't want to expose their bodies to anything for it. So the traditional method, it's based mainly on the individuals. Okay. Yes, it's very individual based. So it fails a lot. That's also another side effect. Yeah, it fails a lot because it's individual based. Yeah. People don't do it right, and therefore it fails a lot. And then we have your IUDs, your intrauterine devices, and then you have the permanent methods. Ooh. Yes, that is where the vasectomy and the BTLs come in. Okay. Yeah, so vasectomy for the males, and then BTLs for the females. Yeah. Okay. And then let's talk briefly about the emergency contraceptives. So emergency contraceptives, it will also entail the hormonal as well as the IUD. So those are the two emergency contraceptives we have. You have the hormonal and the IUD. The hormonal, if you take it within 72 hours, the earlier the better though. But within 72 hours, it should give you some protection. And the IUD within 5 days.
Some protection, not full protection.
Not full protection.
Really?
Yeah, not full protection.
Okay.
Yeah. So the IUD, if you're able to insert it within the 5 days of sexual intercourse, it should also give you some protection from pregnancy.
All of them is some protection.
So there's always that tiny chance that you will fail.
See.
Some kids are stubborn.
They just want to come.
Yes. Okay. So there's always that tiny chance that it may fail, but usually it works out fine for majority of the people.
Okay. Okay. So you mentioned the traditional method, which usually fails. Which one? What? Okay.
So let me go back to the top.
Okay.
So for the barrier method, we have the female and the male condoms. We have what we call the cervical cap. We have the diaphragm. They all cause mechanical block between the sperm and the egg. And then when it comes to the hormones, we're talking about the pill. We have the oral combined contraceptives, and then we have the mini pill, which is the progesterone only pill. And then we have the injectables, commonly Depo-Provera. It's taken 3 monthly. It's also a hormonal therapy. And then you have your implants, the tiny rods we insert into the arms to make sure you don't get pregnant. And then we have there's a patch, the contraceptive patch, and then we have the vaginal ring as well. That also is hormonal. So and then we come to the traditional method. So for the traditional method, that is where you find your coitus interruptus. That's the famous withdrawal method. Yes, and that's purely based on the man. Yes. So, and you know how, I mean, I'm not trying to start a fight, but can you trust a man? Can you leave your reproductive wishes in the hands of a man? So, well, it explains why I feel. Yeah, it explains why I feel. So, yeah, so that's the coitus interruptus. We have what we call the lactational amenorrhea. That is for breastfeeding mothers. So usually when people have new babies, they don't expect to get pregnant. But the conditions are very strict. You have to be breastfeeding your baby at least 4 hourly, even throughout the night. and then it has to be exclusive for the next 6 months for it to work effectively.
Wow.
And you know how for the next 6 months anything can happen.
Yeah.
So it's not totally dependable. But yeah, that's also a method that, you know, initially people used to use, and even currently, some people are able to stick with it, so they're protected for the next 6 months after their new baby.
Okay.
And then people know when they're ovulating, their basal temperatures increase. There's something we call the cervical mucus. Okay. So people explore to actually know what kind of mucus they are producing. If they are producing the thick, white, non-sticky one, they know they're safe. They can play around. But when you start producing it feels like an egg, the white of an egg. And it's not as sticky. It stretches. Then you know that it's not too safe for you to be having sex. So these are things that it's very dependent on how observant the person is. So once you get careless, it doesn't work for you anymore.
But there are apps. I mean,
there are apps too. And then the safe period. Yes. If you have if you have a regular period, then you should be able to track to see when you're safe, when you're unsafe to have sex. But the problem with these things is you may not even want to have sex the whole time you're safe. And just when you're ovulating, the devil comes knocking on the door. So these, they are natural, they are effective to some point, but they fail because it's dependent on how observant the person is. So once you miss your information, then you're at risk of getting pregnant.
Okay. Before we continue, we'll go on a quick break. When we come back, I'm sure you have a lot of questions on the pill. People say when we take the pill, you miss your cycle, or your cycle just delays, you get moody and all of that. Doctor is going to explain all of that, so please stay tuned. You're welcome back from the break, still discussing which contraceptive method is best for you. Before we went on the break, we are still discussing, and you are welcome back. Doc, let's move on. If I take the pill, there are people who say when they take the pill, they start to gain weight, there are cycle delays, and they start getting moody. It's like it messes with your psyche a bit. Yeah. Kindly help us with those details.
Okay, so contraceptive pills, like any other medication, has its own side effects, and they're right. It's been reported that a few people gain weight on the pill, and yes, it's something that has been noted to be associated with the hormonal type of birth control. But recent study actually shows that the weight gain is not due to fat. It's actually just water retention. If you give it a few months, it should resolve, and then you're back to your regular weight. And then there's also another thing. The hormones. Think about when you are ovulating or menstruating, how you crave and how much you eat. Yes. So sometimes, because it's a hormonal treatment, it makes your cravings go over the roof, and then you start eating without any control whatsoever. Then you start to gain weight. Then you're putting it on the pill. But really, it's
your own craving.
Exactly. So if you're on the pill, it's just something to look out for. If it's something you're expecting, then it's easier to notice when it comes up, and then easier to curtail because it's something that you're anticipating. And then that's it about the weight gain. The mood swings, yes, hormonal treatment gives you some mood swings. And also, I'll take you back to your own period. How angry are you, or how patient are you when you get your period? Sometimes you don't even want to talk to someone. Sometimes you're angry for no apparent reason. So yes, because it's sort of mimicking your cycle, it will mess with your psyche a bit. It frankly gives some people borderline depression. So it's also something we look out for. Before we give you a contraceptive, we sit down with you. We have to talk about all the side effects so that you are able to anticipate which ones are likely to occur with what you are on and how we can help you get out of it. So yes, it does have side effects, but they're not things that we cannot control, or manage, yes.
Okay, so before we came on set, you talked about the mini pill, as in there are two types of pills. Kindly tell us more about it.
Okay, so there are two kinds of pills for contraception.
Okay.
We have the mini one, the mini pill, which contains mostly progestin.
Okay.
And then we have the oral combined contraceptive, which was a combination of both the estrogen and the progesterone. Yes. So usually people are on. It used to be the combined pills used to be quite popular among young people or non people who are not nursing mothers.
Okay.
But recently, I've noticed that people are actually going on the mini pill.
Okay.
So more people are actually taking the mini pill.
Okay.
But there's the oral combined contraceptive that is also available. But if you're a nursing mother, we prefer that you take the mini pill.
The mini pill.
Yes.
Okay.
So that it doesn't interfere with breastfeeding and all that. Yeah.
Okay. So you talked about the fact that the mini pill is able to, it gets to a point where your cycle doesn't come at all.
Yes, so it's a side effect. It's desirable for some people, it's not for other people. Some people don't want to deal with their periods. So this you can take the mini pill for a while, and then after some time, there's a possibility that your period doesn't even show up anymore. Yeah, you're just a free bird.
Flying around. Okay. Okay. And then the emergency contraceptives, the one you take after unprotected sex.
Okay, so yes, that will mess with your cycle a bit. That will mess with your cycle depending on the time you took it in your cycle. So it may delay your period, or your period may actually come
regularly
sooner than you anticipated. Yes. Okay. But it's not something. It's an emergency contraceptive.
So you don't advise that you take it.
It's not a long-term plan for contraception. So if you need a long-term plan, you can get a long-term plan. But if for any reason there was an emergency sex that you need emergency contraceptive for, it's always available. But it's not advised to be used regularly. Yes.
But then the mini pill is...
Yeah, the mini pill, the mini pill is available. The combined pill is available. The implants, the injectables, everything is available. You just need to walk into a clinic, a family planning clinic, and then they will tell you all about it. Okay.
So what will a doctor consider before putting you on a particular contraception?
Okay. So usually we want you to tell us what you want out of this treatment. Okay. What are your desired goals, especially reproductive goals? Do you want a permanent contraception? Have you had enough children? Are you old enough? Do you feel like you don't want any more kids? Then we are looking at the more permanent methods, such as a BTL or a vasectomy. And then we will also look at your lifestyle. The hormonal contraceptives actually expose you a lot to cardiovascular diseases. So if you're someone that smokes, it's not likely they'll put you on hormonal, because it will make the risk way higher. Yeah, so your lifestyle also comes into play. Talking about lifestyle, do you easily forget things? How are you with taking medications? There are people that can't tolerate oral medications at all. It takes a whole army to try to force something down their throat. So if you're someone of that sort, taking a pill every day will be a challenge. So of course the pill is available. It will probably be good for you, but I won't offer it for you because it's not appropriate for your lifestyle. We will also look at the cost. In Ghana, cost is not really a problem because most of our contraceptive methods are subsidized. So yes, you think about cost, but really at the end of the day, cost doesn't really play a vital role in this part of our country. They are all around the same price range. Yes. And then we'll also talk about your comorbidities. Are you hypertensive? Are you diabetic? Do you have a previous history of DVT? Then it will be appropriate to put you on something else apart from hormonal. So yeah, these are your other medical conditions are reasons why you will choose one particular one over the other. And then we talk about side effects. What are the things that you can live with? What are the things that you can't live with? There are some women that cannot think about the fact that they'll never get their periods again until they are off the pill. Their periods are so important to them. Like, I mean, I can't say I'm jealous of them. Yes. But yeah, so we'll talk about the side effects, and then you decide which ones you can live with, which ones you are okay with, which ones you absolutely cannot deal with. So that goes into choosing contraceptives as well.
Okay. Can a woman experience pregnancy complications as a result of the continuous usage of a pill?
No.
Nothing like that.
No.
You have a smooth pregnancy.
Yes.
Wow.
Yes. That I can say for sure.
Really?
Yes. Your pregnancy issues are not related to your contraceptive use. People want to say infertility is due to the fact that you use contraception.
Yes.
It's not true.
It's not true.
It's not true. So contraception is just preventing pregnancy in you. So once I take it away, your return to fertility is usually immediate. So I put you on the pill.
So not like a 3-month space for you to return
exactly.
to
So it depends on what you are on.
Okay.
It depends on what you are on. If you're on the pill, that's why the pill, it's very important to know when to take the pill. Because if you miss even one pill and you have sex in that time, you can't get pregnant. And in your head, you feel like, oh, I just missed one. But you will get pregnant because it's hormonal, it's regulating the hormones. So you're on the pill, I take away the pill. It just takes a month for you to return to your old cycle. So you can get pregnant if you are trying.
Okay.
Right? Let's go to Depo, the injectable. So I inject you with some hormones. It takes 3 months to wear off. And in another 3 months, you have to repeat it.
Okay.
So if you take one now and tomorrow you decide that, oh, I want to have a baby, you have to wait for 3 months for it to wear off.
Really?
Do you get it?
Okay.
So for methods like that, the return to fertility is in 3 months.
Okay.
For IUD, you put it in when you want to have a baby. You take it out. The mechanical reason why you couldn't have implantation has now been removed.
Okay.
So you can get pregnant. So for most people, they get pregnant between the first 3 to 12 months. In 12 months, most people achieve pregnancy if they can get pregnant.
Okay.
So the reason why you will get a delay is probably from methods like Depo, like the injectables. So those will take a while for them to wear off. But once they wear off and then you don't replace it, you're free to get pregnant. And undiagnosed infertility. Me and you that we are sitting here, we have never checked. We have not had proof of fertility before. Yet in our heads, we are women, so we have babies. And then we go and take the pill because, oh, we don't want unwanted pregnancy. And then just when we're ready to have a baby, we take it out and the baby is not coming. And then we are like, oh, it's the pill I took. It's not the pill. You probably had undiagnosed infertility before that you didn't know about. So it's not related to the contraception. People who can get pregnant will get pregnant after going off the contraception. And there's also societal pressure. Babies, my mother will always say babies come when they are ready. So when you put too much pressure on yourself, babies tend to delay. So relax. Yes, when you put too much pressure on yourself, they delay. They come when you least expect it. They are so annoying. They come when they are ready. Yes. So sometimes you take away the contraception and you're like, oh, I want to get pregnant. You give yourself time. You're not having enjoyable sex. Because the whole purpose of the sex is to get pregnant. So much pressure on yourself. So much anxiety, so much stress. And then the babies are like, nah, we don't want to live in this environment, so we're not coming. So just when you sort of relax about it, oh, babies come whenever they want, you'll be surprised. You will get pregnant. So yeah. If you go off any of the methods and then you're having issues getting pregnant, it's always safer to have a thorough check so that we know exactly what is happening. But it won't be because you were put on a pill or you had a Jadel implant or you had an IUD. It's not.
So would you say all the contraceptive methods are safe?
They're safe.
They're all safe?
They're safe. They are safe. But safe is relative.
Safe is relative.
Yes, safe is relative.
It depends on how you use it and everything.
Yes, it depends on how you use it. It depends on how healthy you are. It depends on your social habits. Do you smoke? Do you drink? Yes, all those things come into play. So it's relative, but it is safe. It is safe to use the contraceptive methods.
Okay, we're wrapping up. I want to know your final words, and then we'll do part 2.
Okay, final words. So contraception is quite important. It is very dear to my heart because it empowers women, especially who have no say when they are in an abusive relationship and all that. So it's quite important, and it's a good option for everyone who needs it. It's safe, and it's always good to talk to your healthcare provider before you decide on which one is good for you. And then it's always good to talk to your healthcare provider about the side effects you're afraid of, so that they can talk to you about ways of managing it.
Okay.
So yeah, in a nutshell, I am pro contraception. If you didn't get anything from the show, you should get contraception if you're not ready to have a baby. And if you don't have, just one partner, it's safe for you to have the kind of contraception that will protect you from STIs and the kind of contraception that will protect you from unwanted pregnancies.
And you provide that counseling service here at Staywell.
Yes.
All right. So now you know, if you want to start using the contraception, please come to Staywell Healthcare and they will take care of you. That's all for today. We'll be back with part 2 of contraceptive use. Thank you. My name is Bridget Ama Denteh.